liver surgery. Okay, thank you. And liver transplantation from the Funden Clinical Institute. First, I have the honor to present the most international renowned live Romanian surgeon, being a former promotion and internship classmate and friend of his, for a while holding the same position as president of the Romanian Society of Surgery and editor-in-chief of the flagship journal of the society, Chirurgie, Surgery. We both had the chance to be disciples of great professors, Irinel Popescu under Professor Dan Setlacek, respectively, I under Professor Simic, where we learned the essential gestures and technique in general surgery. Professor Irinel Popescu has the chance of a long internship in the United States on problems of major liver surgery and liver transplantation, being even a collaborator of Professor Thomas Starzl. Returning to the country, showing an extraordinary ambition and perseverance, and despite many obstacles, he managed to implement with adequate equipment for the first time in Romania the program of liver transplantation and major liver resection. Demonstrating collegiality, pedagogic spirit, and generosity, he managed to form several transplant teams led by Professor Vlad Brașoveanu, Professor Mihnea Ionescu, Dr. Doina Hrehoreț. More than that, he also helped to establish other liver transplantation centers, apart from Funden, right here at St. Mary Hospital, Bucharest. In Iași, through Professor Cristian Lupașcu, as well as in Chișinău, Republic of Moldova, through Professors Vladimir and your son Adrian Potinean. Professor Irinel Popescu is also one of the promoters of advanced laparoscopic surgery in Romania, culminating with the introduction of the robotic surgery. Of course, there is no point to monopolizing the discussions that might seem subjective. Professor Popescu being my colleague and friend, and as such, I will allow myself to give the floor to the professor's distinguished guest of this event, prestigious surgeons with whom he has collaborated.
It's a pleasure and tremendous honor for me to present somehow the activity in Romanian surgery along about more than 40 years. And from the beginning, I would like to say that it's like a chain, a continuous chain. I learned something from my masters. I was involved in advanced surgery even as a resident. Then I became myself a professor and mentor. I formed my team. I developed other procedures together with them. They were prepared to take over from very early, and now they are taking over. But again, in their turn, they form other teams that will continue to develop Romanian surgery. So therefore, it's like a chain in which each one has his place. But the problem is that same idea of continuity and mixture, because some procedures you develop together with your master and then other together with your juniors and your team. During my presentation, I'll try to emphasize these aspects. Well, so I was born in 1953 in this small town in Oltenia. And I graduated from this lyceum from Craiova in 1971. And then from the Faculty of Medicine of the Institute of Medicine and Pharmacy in Bucharest. So talking about this, we are promotion of 1977, which was I would say, the year of the earthquake in Bucharest. Not very fortunate from this point of view, but we were a very fortunate promotion. Our chief of promotion was an internist. He was admitted with maximum with 10, which is maximum in Romania, and finished with same 10 in at the end of the 6-year studies. And then there were 3 surgeons, which was myself, Silviu Constantinoi, and Petișor Javlete, and we got the 3 of us. We got a professorship later. Myself, I got this prize at the end of the faculty for a best result combining the graduation grade and the internship. So for me, this year, 1977, the promotion, and my colleague, especially Silviu, because Petișor went in neurology, but with Silviu along the years, we developed several times, and we kept a very close cooperation. Then the internship at the time was very useful, the French style, 3 years of internship that I spent in the hospitals of Bucharest with great masters like Professor Juvara or Professor Șuteu. This is an operation where I was just third assistant or fourth assistant maybe with Professor Juvara and Dr. Irinel Popescu, who was my mentor at the time. And then in 1980, I was admitted as assistant professor in Fundeni Hospital with Professor Dan Sedlacek. Well, that was next step and the most important in my surgical career, because the volume of operating activity in Fundeni was really big. And well, I had the chance to assist the professor from the beginning, but also to operate myself. That was one of the characteristics of Fundeni department. The professor pushed us towards early development, and under his supervision, we managed to operate quite early with my colleagues. Here it's Costi Popa and Mihnea Ionescu to the left and to the right, and Silviu Ciura and myself and Ali Alub in the 80s. And then we started experimental liver transplantation. Again, the idea was the professor to push us towards this new procedure. We had all the admiration to Thomas Starzl and what he did. In 1990, I got the highest degree in medical career and also my PhD. And from this moment, after the communist collapse, I started a 5-year period of specialization abroad, starting bit early in 1989 with Dan Tulbure in Charité. For a while, this is Dan Tulbure, a very important person in the development of the program of transplantation and surgery in Fundeni, because without him, nothing would have been possible. And after Charité, we went also together with Dan Tulbure in Paul Bruce under the guidance of Professor Henri Bismuth. We spent there only 2 months, but these 2 months were crucial because later on I met Henri Bismuth in Iașcu and then in Isa. Even now, next month, I will meet again him in Isa for 30 years anniversary of this association, which is a very important one. And then I went in the States, initially in Pittsburgh, with Tom Starzl, who became a very dear mentor to me. And guided me in the most difficult moments of our program. This is the acceptance as a research fellow in Pittsburgh University, signed by John Fung, the acting director. And this is next to me, my dear friend Andrei Stiber, associate professor later on in the University of Emory in Atlanta, and at that time an associate of Tom Starzl. And then I moved to the Mount Sinai Hospital, New York, where I spent the next 2 years and a half. This is in December 1994 when I left the Mount Sinai. This is the letter from Charlie Miller mentioning what I did there as a research assistant and later as a surgical coordinator. These are my colleagues in the Mount Sinai, Italians, Japanese, Americans, so the fellows at that time in the Mount Sinai. Then I came back in Romania, and between 99 and 2000, I would say, I tried to establish and to set up the program of liver transplantation in Funden, starting with a team. I found there Vlad Brașoveanu. He was a resident, I think, in the last year. And after 2 years, Doina Hrihores came, and they were the two main surgeons that I trained and that now are independent liver transplant surgeons. But also in the team, Sorin Alexandrescu, Emil Matei, Leo David, Razan Fir, Mihai Grigore, Dorin Pietreanu initially. And the other team, actually under Associate Professor Mihnea Ionescu, my colleague and friend, who was, at least in the beginning, involved also in liver transplant program and in major surgery. Well, in Romania, I had to do many things like law or, regulations and, promoting the concept of brain death and discussion with the Orthodox Church and promoting the concept in the media. It was very difficult in the beginning in a country where the activity of transplant from cadaveric donor was zero, was no cadaveric donor, and no practice how to harvest even the operation, which, as you know, is not easy, was never performed before. We founded the Rome Transplant Association, which was an important moment. In 1999, and I was appointed representative of Romania in the Council of Europe, and I came back with the regulation, European regulations in transplantation. But also I took part in the activity of Romanian Surgical Society, and these are three of my dearest senior colleagues that I cooperate with, Professor Nicolae Angelescu, Professor Corneliu Dragominescu, and Professor Cristian Dragomir. Also at international level, I joined very early IASGO. IASGO, it still is, and it will always be my dearest association because of this concept, health for all, medicine without frontiers, that in countries like Romania, we always dream about this. In 1996, Tazel came in Romania because we translated into Romanian his book, The Puzzle People. This is the Romanian translation. In 1997, there were first harvestings from cadaveric donors, initially in February 1997 in Funden, and then in Floreasca Hospital with Dr. Ioana Grințescu, and the coordination of a multi-harvesting multi-organ harvesting, as again I emphasize, is not easy. You have to be able to prepare every single step and to know all the details, and to start, of course, with the long incision with sternotomy and then abdominal incision, which actually I have to admit, the exercise of the 3 years I spent in the United States was crucial, because most of the time in the Mount Sinai, I did liver harvesting, and at that time I had more than 200. And then in Romania, first harvesting, this is first harvesting in Târgu Mureș with Professor Radu Deac, and you see the operating team. It was Târgu Mureș Surgical Department, and Professor Deac was writing the composition of the team, which start with myself, and then Professor Günther Laufer from AKH, and then Professor Deac, and then my dear friend, Professor Șerban Bancu. Also in 1997, in June, I did the first liver transplant in Funden. That was not successful. Initially, I was together with the cardiac surgeons. Professor Dinică is here, but also Professor Băilă was together with us initially for the initial operations. And well, I remember because it was a debate because the patients did not survive, but those colleagues witnessed that this was not a technical failure necessarily, but was more because of the ground of the advanced disease or the bad liver that we transplanted in a second case. or a cerebral vascular accident in the third case. Therefore, we went through, and well, it's interesting at the world level, it happened the same. The first transplant operations were done in 1963, initially in Denver and then in Boston by Frenny Moore. Also, patients did not survive. The Time magazine decided to make the cover with one of the pioneers of liver transplant. They considered the operation so important, then they devoted the cover of the Time to a liver transplant surgeon. And between the two was chosen Frenny Moore. Well, unfortunately, it was not the right decision. But anyway, this was only in the long run. Same happened in Romania. After my first liver transplant in 1997, I received this letter of congratulations from Professor Sergiu Duca, one of the pioneers of the method in Romania. And I received also a prize at a ceremony where the King Mihai got the first prize. So it was an important ceremony at the end of the year. At the same time, I tried to establish relations in Europe, and I was very lucky. And in this picture, there are the main people that mentor me and help us in Europe. And you see again in the middle, Henri Bismuth, but then Christoph Roche and Massimo Malago, who is here, and I thank him for coming. And the Niguarda team, Professor Forti, Professor De Carlis, Andrea De Gasperi, and Antonio Rampoldi, all from Niguarda Hospital, Milan. And we operated a lot. Actually, we started major surgery, especially hepatobiliopancreatic in Funden. And at the end of 2000, I got those certificates. I had to be certified in my own country in hepatic surgery. There was no hepatobiliary at the time, just hepatic surgery, and then laparoscopy. Like this, I could officially develop the program. And then the year 2000 was a crucial one, because you see on the left side, 30th of April, 2000, with George Pena at the church to celebrate Easter after his successful operations, his successful liver transplantation. Closely to this moment, at the beginning of May, was the second George Bada, that was transplanted, and after this, the program took fly. See the both of them, George Pena and George Bada, 22 years later, in good shape. They now are 23 years later. They will be in the next room, both of them, and this is, I would say, quite emotional to see the first transplanted patients surviving and in very good condition. And this is Timea Balog, and Max will tell you more about this because he was there with Professor Brosh, who is Giuliano Testa also for this transplant. And now Timea is at her marriage, and after the marriage, she gave birth to a little baby. She will be also next door, and as far as I know, she tries to come with the little baby. We started the program, but there are very few donors. And because there are so few donors, we did even advanced procedure, much more advanced compared to the experience of the team, like this domino transplantation for familiar hypercholesterolemia. And actually was a combination of split and domino. Starzl actually encouraged us to publish the case in Transplantation. He was one of the reviewers. This is the article in 2003. And this is his letter saying that it is a splendid contribution. Well, in the long run, there are not many indications, but we proved that this was a good indication because the patient that received the liver deficient in LDL receptors, because the reason why the patient developed hypercholesterolemia, put into a recipient with peripheral receptors, allowed this to survive also 23 years, or 22 actually. She was transplanted in 2001. It's alive and quite well under medication, of course, but it's alive after 22 years. The indication was hepatocarcinoma, and expected life was short, but as you can see, was long survival and in good condition. And then in 2003, with Max and Professor Brosh, we started a living donor from a adults. And in 2003 was an important meeting in Bucharest. And in this picture, you can see some of the people that really were important for the program. Tom Sarzel and Christoph Broersch and Domenico Forti. Jack Lake is also here in this picture. In the upper row is Dan Tulbure, who is Luciano De Carlis, is Professor Copotoiu, is Liviu Vlad, and others. Our center became in 2006 Center of Excellence in General Surgery and Liver Transplantation. In 2007, Sarzel encouraged to publish the follow-up of the case with familiar hypercholesterolemia. In 2009, 2010, I sent my team, especially the doctors Brașoveanu, Hrehoreț, Leo David, and Emil Matei in Asan Center in Seoul. And after this, we increased the number of living-related transplantations, and we start to reconstruct the 5 and 8 segments vein. And our center became a high-volume center with more than 50 procedures. We did improve actually or diversify the procedures with split transplantation between an adult and a child, split transplantation between 2 adults, and dual transplantation. To the left, it's a girl that received 2 fragments, one from the mother in the middle and one from the sister to the right. So this were area of very high activity. And the numbers, this was were the best year, 2013, 2014, 122 procedures. In 2013, it was clear that it's too much for Funden Hospital. So we opened a second program in Sfânta Maria Hospital. Therefore, the next year were exactly the same number, 122, but in Funden only 105 and 17 in Sfânta Maria. And yeah, we have since then put the cases in ELTR, European Liver Transplant Registry. It's also a very recommended procedure from my point of view to have cases in national or international registers. So here are the results. The results are not much changed since then. 7 something mortality and survival 1 year, 3 years, and 5 years. Then in the same year, 2013, we opened the program in Chișinău. Adrian Hotinanu is here. I thank him for coming. I have to mention the close relation of friendship with his father, Professor Vladimir Hotinanu, the one that founded the program, the one that set up the new operating theater in Republican Hospital in Chișinău, the former head of the Department of Surgery in Republican Hospital. We are here, both of us, and in the middle is an Olympic champion from Republic of Moldova that was transplanted in Bucharest. And then, so again, I mentioned Sfânta Maria program and the role of Dr. Hrehoreț. And then we became sort of regional center. And my friends from Bulgaria and Serbia are here. Some of the young guys from those 2 countries came in Funden to see and to assist the operations. In 2016, a new program in Sfântul Spiridon Hospital in Iași, led by Professor Cristian Lupascu. And a new method that we introduced the same year in Funden, this liver assist that allows the recipient surgeon to be more calm and so more confident, because if there is a difficult hepatectomy, liver is put on the machine, and so the surgeon is not in rush like before. This is perfusion, either portal vein and artery or just portal vein. Nothing special, now became almost routine. So this was about liver transplantation, but at the same time, we developed the hepatobiliopancreatic surgery. They came together, especially since we introduced split and living related. And this is all the procedures that we introduced, major hepatectomies, total vascular isolation, posterior approach in DCP, total mesopancreas excision, vascular resection in pancreatic surgery. Some of them were actually practiced with a lot of success by the members of the team already, like those vascular resections by Vlad Brașoveanu, or echo-guided liver resections by Florin Bota that studied with Guido Torzilli in Milan. Guido was also studying with Makuchi in Japan. So some of them, and we received this very well, because the problem is we are always focused on the patients and development of surgery to the benefit of the patient, not who is in charge, and not exacerbated egos and things like this. I think the most important thing was the patient and the results. Here it's a perfusion, a dual perfusion in an old donor. And then the last procedure, auxiliary liver transplant for acute liver failure. As you can see, in acute liver failure, you can remove the left lateral, replace it with a good liver, and wait for the liver to recover. If the native liver recovers, this will get atrophy or will be surgically excised. Otherwise, it will replace the liver and it will save the patient. And then in a private hospital, which is Sanador, in 2020, we opened the first liver transplant program in a private hospital, and recently the pediatric liver transplant program in Grigore Alexandrescu Hospital, Children's Hospital. So now we have more than 1,200 liver transplants in the whole country. We have two strong national associations, the HPV Association and Rome Transplant, the old association, with new leaders, Professor Vlad Brașoveanu, Nadim Al-Hajar, Cristian Lupascu, Adrian Kovic, she is nephrologist. We have guides and protocols of the Ministry of Health, and we have a national treaty of liver transplantation and HPV surgery. So I think this is very consolidating, and now it's just a matter of refining procedures and increasing numbers. And these are some of the patients. Top left is Dan Tulbure and Doina Hrehoreț. This is a day of transplantation that we will celebrate next door after this session finish. And young Timea Balog at that time, and you will see her now at this time. And finally, I would like to put this short video with Tom Sarzel in 2017, which I consider a very good description of implementing a liver transplant program here. Poftiți? Da, asta am cerut, dar nu știam ce răspuns a fost de la tehnic. Aha. That was an IASGO Congress, and Tom Sarzel was previous president of IASGO. Years ago. What representation from all aspects of gastroenterology, this is treating etc. It was just the right thing to bring together the whole problems, function, physiology, pathology, gastrointestinal tract. So you're doing it again. I think it's a great society. It's probably has a unique function, educational function for people interested in those various subspecialties. The other thing that I wanted to comment on was the activities and successes that you get here about leadership. That's true. Not only in connection with these meetings, but this one, that's that set up. It's almost like a miracle, like it's these oases that just suddenly appears in the desert after somebody, a single individual parachutes in
maybe like ours. Anyway, that would be you here now. I think you've done a terrific job in what you've done here. And I mean, it's a job for which you deserve to bring credit. I don't want to talk to them about that. It would be my tendency. I just know that there would be a lot of people out there that I know personally. And to each and every one of you.
Of course, that I'm very proud of what he said because he speaks about two things very dear to my heart, IASGO, which is my favorite association, and the transplant program in Bucharest. And after this year drives me. This letter actually was from January 26, 2017, was his last letter. He died in that year, and he wrote just 3 lines, but 3 lines, as you can see, saying that I don't know anyone who came under my influence, of whom I am more proud. This is very honoring, and of course, it's one of my dearest recollections. So I talk about HPB surgery and the development of this. Now a few words about robotic surgery. Well, I'll come over on this topic, but starting with surgery, we established 3 teams from the beginning. My team, Cătălin Vasilescu's team, and Victor Tomulescu. And we developed everything. Initially, first operation was 2 and 3 by segmentectomy, but we did even major procedures like DPC or right hepatectomy. Doina Hrehores performed this, total gastrectomy or rectal resection. But combining robotics with laparoscopy, actually we implemented as a rule minimally invasive approach in colorectal. So therefore, for us, colon surgery was laparoscopic, rectal surgery was robotic. Rectal cancer was the favorite disease that we operated robotically, and generalizing the minimally invasive approach in colorectal was a very good step to develop surgery. And then we set up the regional association, Southeastern European Association of Robotic Surgery, with Konstantinos Konstantinidis, our colleagues from Bulgaria, Professor Gorchev, our colleagues from Cyprus. So it was a nice association that had interesting activity for several years. Well, actually, after the program often stopped because of no financing from the ministry, this was before it was developed in other hospitals, like Pandur Military Hospital, Timișoara, with Professors Ciprian Duță and Lazar Fulger. And then some of the young members of the team at that time, like Victor Tomulescu, Ana Stăciulă, and Iulian Moșteanu, developed themselves as minimally invasive surgeons. Here, I got a prize for more than 1,000 interventions in the robotic program. Talking about surgery, either transplantation or HPB or robotics, I deserve, and my team deserves a lot to this hospital. This hospital, Funden Hospital, offered us everything, an exceptional infrastructure, and especially professionals of very high quality in every area. So therefore, these successes would not have been possible without Hospital of Funden. And honoring the fact that my professor was a pioneer. He was in this hospital from the beginning. His monument is now in front of the old building of the hospital. That's why I'm very proud that along the time, I was the medical director of this hospital 2 times, and then I was, and now I'm director of the Center of Digestive Diseases. And we received some important visits. This is the then Prime Minister Muguri Sărescu, and this is King Mihai of Romania, while I was in this position. So Along the years, I did some political and administrative work, and I would like to say from the beginning and to quote two classics of Romanian surgery. One is Constantin Dimitrescu Severanu, the founder of the Romanian surgery. The other is Eugeniu Proca, the author of the first kidney transplantation in Romania. And both emphasized that without involving themselves in politics, it was impossible to achieve what they did achieve. And Constantin Dimitrescu Severanu, at the end of the 19th century, he said that without being involved in the politics, he was in jeopardy to be allowed to do surgery and to deliver the courses to the students. And especially my friends in the Balkan area know what I mean. Not to speak that for an advanced procedure as liver surgery, where you need a lot of things, and when I came back from the States, there was nothing. So you have to get involved in this. So along the years, I had some positions in the system of Romania. And just to reinforce the idea, I will tell you shortly the story is the robot. I was Secretary of State in the Ministry of Health. We ordered a robot to start robotic surgery, but the robot arrived in 2001. I was no longer Secretary of State, so the robot was redirected to another hospital, which didn't use it. Finally, after 7 years, we got another robot from the Ministry of Education, and I'm very thankful to the rector of the then rector of the University of Medicine, Florian Popa, who actually supported to get the robot. We started the program and we are very successful. But in 2013, the Ministry of Health stopped financing because I was no longer in charge, in no position. So that explains exactly what does it mean, the mixture of politics and medicine in this area. So I was a professor at the University of Medicine and Pharmacy, Carol Davila, and then at a private university called Titu Maiorescu. And now on Sunday, I leave for ENA for the 4th year of professorship in Italy, which is a nice area and a job that I like. Many activities with the students and meetings, or in the dog lab, in the experimental lab. Sorry. I have about 20 PhDs and about 4, as far as I remember, with ability thesis. And I, along the years, I did research because that's what I learned in the States. In Pittsburgh, I work with Satoru Todo in the dog lab. In Mount Sinai, I work myself with isolated perfused red liver. So for me, research was a priority. First of all, in translational medicine, I founded first biobank, probably one of the first in Eastern Europe. And based on this, in 2012, this center of research. And so here, providential person was Dan Duda, who is in the audience, and I thank him very much, because along the year, from his position in Harvard University, he guided us what to do, how to do in genomic research, and this was of tremendous importance. And we celebrate recently 10 years since the project started, and this is experimental surgery. Professor Rubinski is here, and he delivered an excellent lecture yesterday where he explained what we did in electroporation distractions of liver tumors, and now maybe of liver tissue to create a cavity to implant pancreatic islets, and also in isochoric preservation of the liver, which is, I think, a very, very interesting method. And we did accept research, also teaching in this resort in the Center of Excellence of Translational Medicine for young students or residents. This is, simulation. So in Alexandrescu does also, proctoring the young students or residents. This is a project in research with Israel trying to transform hepatocytes in pancreatic islets. This is the liver in isochoric preservation, and some of them were in good shape. On the right, you see a liver that was got off from the recipient 40 hours later in pretty good condition. This is the recipient. Looks quite primitive so far, but I'm sure Professor Sherban and the engineering team will develop more refined models. So this is shortly what I published. because yeah, you have to publish. Starting with the 80s, I published some monographs when I was an assistant of Professor Sedlacek, and some manuals. And this crucial monography, textbook actually on liver surgery in 2004, with forward by Tom Starzl and another one by Bernard Launois. And again, some manual of surgery and 2 editions of the National Textbook of Surgery, one in 13 volumes, the other one in 10 volumes, and now a third one that we are working together with Professor Constantinoiu, continuing our cooperation along the years. This is the 2nd edition, is Professor Ciuce from Cluj. This is the textbook of HPB surgery that is now at the 2nd edition. This is a textbook on liver transplantation. I was part of some international textbook. In this textbook of Vijay Khatri, I wrote central pancreatectomy and the extended pancreatectomy with resection of the celiac axis. And I was one of the editors of this recent textbook, or YASGO textbook of multidisciplinary management of HPV diseases. Actually, this is the most recent, website, Scientometry. I was member of some association, starting with YASGO that I like a lot. And here is Nick Ligidakis, our common mentor in YASGO. And here is the 2 current Secretary Generals, Professor Duda and Professor Kirici Takaori at the Romanian Academy. And here is the best meeting that I organized ever in 2007, was the YASGO meeting. The President Traian Băsescu speaking, and in the presidium with Professor Florian Popa, the then rector of the university, who is the President of the Republic. Again, with Nick Ligidakis, and now with dear friends, Nicola Vladov, and Zora Milosevic, and Achim Asanakawa, and Hosong Han, who trained actually for 1 year 2 of my people, so Oana Stănciulă and Ilia Moșteanu. So ESA is also important. It's a partner of ESA and has a journal, Annals of Surgery. I'm a member since 2007. I was president in 2017. I was host of one of the congresses. Here again is my friend Silviu Constantinoiu as a president, but on the Real Madrid Stadium where the presidential dinner was organized. And this article in Annals of Surgery, that was my presidential address, and in which I tried to promote Romanian important figures of surgery. This is Dimitrie Gerota that everybody knows, but few people, if any, know that he was Romanian. I was a member in the UEMS on the board of surgery for HPB and transplantation. This is transplantation, this is HPB. I was vice president of Federation of European Academies of Medicine as president of the Romanian Academy of Medicine, member of ESOT, European Society of Organ Transplantation, and because Speranța is here, I hope that we can help her to get the next congress of this association in Bucharest. In Romania, I was president of the Romanian Surgical Society and of the 2 societies that I also founded, maybe 3, Rom Transplant, ARCE, and RCHBPT in Romania, so HPB Society. This is Rom Transplant. This is some of the guests, Domenico Forti, Frank Del Monico. This is founding of HPB Surgery. This is founding of ARCE together with Professor Corneliu Dragomirescu. This is a picture with Catherine Popescu that well, as much as I could, I tried to help along the years and develop an exceptional career, not only nationally, but international. They gave me a prize for my activity in 2019. Association of Telemedicine, I was member of the board of the International Journal of Telemedicine, Romanian Society of Surgery, again with Silviu, who was 4-year term president of this society, and Dan Ungureanu from Titu Maiorescu University. Sorry. I was visiting professor or speaker. Some of these were very honoring. This was a British General Surgery lecturer as the European Society of Coloproctology in 2012, University of Zurich, invitation from Pierre Clavien as a visiting speaker, Grand Rounds in AKH Vienna, University Eppendorf in Hamburg, University Karolinska in Stockholm. I received some titles, so Dr. Honoris Causa, very dear to me, from the Universities of Medicine in Craiova, in Constanța. Here in Chișinău is Professor Brătucu, Professor Hotineanu, Professor Ghidirimen, then Rector Ababei. Apollonia Iași, Galați, where I'm working for this extension in Enna, Sicily, and Iași finally with Professor Viorel Scripcaru, who made me the honor to elect me as honoris causa. In some academies in Republic of Moldova in 2006, in French Academy of Surgery and French Academy of Medicine, in Romanian Academy of Medical Sciences, I was also president, in Romanian Academy of Scientists, and finally Romanian Academy as a corresponding member since 2013. I received some distinctions from the Church, Crucea Patriarhală, from the President of the Republic, Steaua României, and from the Royal House, Coroana României, ordered by King Mihai, and then Order of Republic of Moldova when we performed first liver transplant there, and from France, Order du Mérite. This is Steaua României, and this is the ceremony in 2000 when the then President of the Republic, Emil Constantinescu, gave some awards for pioneering activity in transplantation. Professor Proca, first renal transplant, myself, first liver transplant, Șerban Brădișteanu, first cardiac transplant, then the Professor Radu Deac, Ioan Arcinescu, Mihai Lucan, Vladimir Belish, and Petru Drăgan. And this is a picture with Șerban Brădișteanu, the pioneer of transplant cardiac, cardiac transplantation and cardiac surgery in Romania. So finally, maybe I was a little bit long, but I try to emphasize the most important piece is that during those years where I was not myself, I was me and the team, both me and the team, we learned from our predecessors, both me and the team try to transfer something to the next generations of surgeons. So therefore, I would like to finish my speech saying, God bless Romanian surgery and God bless Romania.
Professor Irinel Popescu, congratulations, kindly congratulations for all your surgical research, editorial, and why not political activity. And now I invite distinguished guest professor to speak about the activity and collaboration with Professor Irinel Popescu. First, Mr. Massimo Malago, professor of surgery in the German hospital Riyadh. Born and trained in Italy, he continued his surgical career in Chicago, Hamburg, and Essen, together with Professor Christoph Brasch, and became a professor of surgery and one of the most well-known and respected transplant surgeons in the world. He moved to London as professor of surgery with University College of London and works now in the German hospital in Riyadh, Saudi Arabia. Professor Malago, please.
Mr. Chairman, Irinel, ladies and gentlemen, it's more a pleasure than an honor to be here, I'm honest. And I'm here for my friend, Irinel. Let me see. This looks like, you know, when you have the press conference of soccer, and you have, this is all the places I visited. I pride myself, and I put here Fundeni because this has been a very important and fun time in the profession and life. I start with some data. You will see that many things I say have been already said by Irinel is confirmation and what I say is true. And we are looking at liver cirrhosis. We speak now of liver surgery and of liver transplantation. And so you see that in Europe, we are in 2000, 2002, there were two countries that were truly standing out for a major problem, which is mortality from cirrhosis. One is Hungary, and here the second is Romania. You look at the others, more or less are in a good position. It is clear that there was a problem, and so the task that Irinel and Romanian surgery was taking was well justified. I am pleased to show you this. This is one of the old slides from my mentor, my ex-boss, Christoph. And this is truly a depiction of the situation before 1983, when there was a consensus conference in Paris, when liver transplantation was transformed from an experimental procedure to a real useful tool in the hand of surgeons, by the way, paid by the insurance. And you can see that the main actors were, of course, Denver, Cambridge in England, and Hanover with Rudi Pichelmeier. We will speak a bit about these people. Groningen, and then you can see that Villejuif was a bit low at the time because Monsieur Bismuth was young. Lesson 1, study the past if you want to divine the future, and recognize the people who are before you. And here we are. These are the transplant pioneers, and the names are important. Thomas Stalzer basically is the one who brought the field forward. But we have Rudi Pichelmeier, and they are on two different sites. And then we have Henri Bismuth, Roy Kahn. I put Ruud Krom as well, because at the time he was important, and my mentor, Christoph Brölsch. I can say that this is not too different, but they are kind of different schools, and I will elaborate a moment, because here we have a pure activity of transplantation, even though hepatic surgery was important. But with Henri and with Rudi Pichelmeier, and even more with Christoph Brölsch, there is a mélange, there is a uniting resectional surgery and transplantation. And this is a different way to look also at healthcare. And there are some transplant centers and transplant and hepatobiliary centers. And I am for the mélange solution, and I call it the European solution, which is to put together the two things. And of course, you have heard that Irinel visited basically all of these centers and chose himself this model, the European model. Isaac Newton says, we stand on the shoulders of giants. And of course, as usual, in the Western world, we think we are the only ones, but it's not true. There is also another world. There is the Asian legacy, and for several reasons, these are the other giants on the other side of the world that basically pave the way for what we are doing now today. Now in Romania, the development of liver transplantation, we have some technological advances and some real important ways to explore the world and the sky. And there is a star that comes, and there is the star in a galaxy that is called Fundeni Hospital, because no star is alone on its own. I consider this article very important. I was present when the association, when Irinel delivered, and I was really pleased to hear. Here you see that Irinel resumes the important steps that he gave. And it is singular that from Romania, that at the time as you know, was in a post-turbulence moment, let's call it like this, was going to visit the world of surgery, and actually the best of the world of surgery. Dan Sedlacek, you know it, you know him. I have the honor that I was invited one evening with Irinel in a very strange place, like a locanda here in Bucharest, with two other philosophers and intellectuals from Romania. It is important to look things from outside. And my impression was first an incredible, important and personality. And second, the aura of this novelty. And I'm not speaking of politics, I'm speaking of looking at the world with new eyes and looking at the world with faith in the future. And I'm really saying that Irinel has that spirit and has that mentality, and this is one of the most important things. Now we are, this is a bit like this, but it is 1998, and you see, where is Romania? Basically, it's not on the map with regards to transplantation, but there is a star, there is a comet. And the comet is coming is Irinel. The first steps are important. I think the resume of Professor Popescu is exemplary, but I would like to show you that before opening a transplant center, you have to have the grounds. It's like if you want to build a house, you have no fundament, the house will go down. And these are important steps. It is important to notice, however, that already in 97, let's say, without the roof of the house, there has been an attempt to do something inside. It failed. It's okay. I remark myself from outside the important engagement of Irinel in politico-social and not only surgical efforts. The environment here is different, of course, than in Western Europe, but this is to me important. It's important also in the personality, because what I like of Irinel is his way to take things and his smooth way to try accommodating some controversies, which is, of course, a skill that not many surgeons actually, it's a skill that most of the time surgeons do not have, but instead he has very strongly, together with a very fine social intelligence. Now we are in Romania, 1997 between brackets, and 2000 it explodes in Fundeni Clinic, through Professor Popescu, the star that comes to Romania. And here we are instead in 2013, when already there is in organ donation, this is organ donation, when there is already some establishment, there is life. Maybe not Spain, but there is life. And so Romania is now on the map. And I wish to focus between many things. We speak of transplantation, but the mentality of the future, the opening to what is new and what could benefit surgery, and particularly patients. And here the true development, a fast phase, an acceleration through many steps of transplantation, starting immediately with a child, and then a domino. I remind, for those who are not transplant surgeons, that these are extremely complex procedures that we do and we developed after many years, and Irinel went immediately into that. All happens in Fundeni. And now the liver transplantation rate, not organ, now liver transplantation, you see already some development also here in Fundeni and in Romania. Now, chapeau, congratulations for having so many patients. And I remind that we do the operations, but there are hepatologists who have the patients and to look after the patients. So it is a common effort of a country, as a common effort of a team, not only of surgery. Here, a split transplantation, of course, we are the pioneers with the school in Belgium of split, and Irinel immediately did this, let's call it the easy split, but also the more complex division in the line of Cantley, and again here, dual transplantation, which I do not want to elaborate, but believe me, is one of the most complex things you can do in surgery. So here I am, because in 2000 already, and then in 2003, we started the big step. The big step is a extremely major step, if I may. And here I wish to elaborate a bit. First of all, starting a living donor program is a major decision in an institution. And we will see some effects of this. You need a strong ethical background. Let's remember that between adults, it's easy to have, and there are some regions in the world where organ commerce is a serious problem. You need institutional support. And so the hospital and the country needs to be behind you, because it is expensive and logistically distinctly Stenfeld, but Irinel had demonstrated already that the surgery was already mastered. I put between brackets societal awareness and agreement, because at the time you just go like a bulldozer and go through. However, it is important, and the societal awareness was basically coming from the political side of Irinel. You need a realistic evaluation on the ground, the need of the procedure, and I showed you that there were so many people dying of cirrhosis in the country that it was a must to proceed. And then an incredible drive and dedication for patients, because this is a tough job, believe me, it's a lot of work. You need a strong team. And here is important. You need risk-prone people. There are different types of personalities. Surgeons usually are daring a lot, but you need achievers. You need risk-prone actors. And let's be honest, a pinch of craziness. Yes, indeed, you need to be a bit mad to put basically yourself, and I'll elaborate now. Patient may gain, but surgeons and institution may lose. And here we have after the loss of a donor in France, Jacques Belghiti, friend of ours, was really like distraught and stopped the program. And here Charlie Miller, as you know, had to change his institution from Mount Sinai after the failure of losing a donor. Now, Publius Gaius Cornelius Tacitus says, iniquissima bellorum condicio est, prospera omnes sibi indicant, adversa uni imputatur. It means when things go well, everything is good. But when things go wrong, you are fault and you pay and you go out. And so this is what I mean by starting such a program. It is a risky, and it's a risk also for the proctor. It's a risk for those who go and have responsibilities in doing what you do. And here we are. We start the adult to adult, and we are all together with Christoph Brosch, Christoph with his cigar in the operating room, looking out of the window and thinking of going hunting, because that is what he liked. He was going hunting the deer, and we were doing the operations in the operating room. And here's some joyful moments of rest. Myself, Irinel, Christoph, and of course Dan, drinking a coffee between donor and recipient. Here, Irinel with Giuliano. Giuliano also came to see us. And of course, what I say is leadership, cooperation, a strong team, and good friends, because professional relationships are not always that clear. And the human aspect many times helps. In this, I have to say, and I'll show you further, that Irinel is a master. He's a master in this because he has a personality that is really helping. Here, another picture, Fundeni and Klinsky, and here is Lubomir came today because in these days we were testing the ground in the Balkans, in Romania, and then we went also to Bulgaria to do a similar experiment. Now, this is a key picture because these are the main actors. I seem to be a white collar, even though I have a blue shirt. I have the, this is the 1996 tie of IHBBA in Bologna. Irinel, as usual, mild and smiling. And this person, this is key. Dan was a pleasure to work with Dan because Dan, always ready, always smiling, insightful. When there was a problem, he had a good way to tell you, careful, let's break, great memories and a great professional. Now, let's start to go. And as I started, I had just developed outflow techniques, and it was important to offer in a new place where no failure is allowed the best possible. And here we were doing with the middle hepatic vein. Look at this graph, looks perfect after reperfusion, but there are some secrets. We immediately applied technology. This was a difficult graph. There was an enormous amount of portal hypertension. And here we had to put a portocaval shunt to decompress the organ in order not to ruin with overflow. And of course, Irene, as skilled socially, was always involved and letting people know. But this is nice because it's one of the aspects of Irene. But sorry, I want to show you this. This is Irene looking at me and saying, "Look, Max, what shall I do now?" with the typical smile that he has. And the attitude, this is important, the attitude of taking life in a light way and always with a smile. We'll come back to that. And of course, it was a hard work and some relaxing moment, everybody laughing and enjoying after moments of work. And here, another case, we do this live donor. The recipient has a portal vein thrombosis. I pull, and the portal vein destroyed behind the pancreas. Basically, we say, what to do? We close the patient. We managed to do a mesoportal shunt, and the patient did indeed do well. What is the important point here? The important point is that even in the beginning, we were not selecting, we were doing the real job. We were going to take the patient who needed the transplantation. And this is a fantastic story because it's a case we did a report at IASGO. So we are there, we are doing the donor, and suddenly a cry from the other operating room. And we realize that on the day of transplant, with the donor already there, there is incompatibility. So we are going to do an incompatible liver transplantation. What to do? Of course, we did the urgent desensitization protocol. It was like a bolt out of the blue. And so, first of all, I was operating the donor, and I say, "Oh, Jesus, what do we do?" And then keep calm and carry on. We took a break. We look in the literature what to do. A perfect organization. We called the nephrologist. We ordered the plasma. We did the plasmapheresis. We measured the titer, a bit slowing the operation, and things went. And this case went fantastic. We also used the intra-operative therapy, again, calmos during the operation. And here the follow-up at 9 months, perfect enzymes, and at 3 months, great biopsy. And I wish to the patient all the best. After that, I did myself some cases. these. It's a cumbersome thing to put a catheter in the artery. You feel a bit uncomfortable and so on. And nowadays, in fact, I work in Riyadh, which is a factory, through factory, 7,000 transplantations, solid organs, 2,300 transplants of the liver. You see the progression in the last years, 297, 304 transplants, where the contrary is true, living donor is the rule, and full minimally invasive since 2002, all these procedures are robotically done. Coming back at the point of small for size, we don't do anymore these arteries things. We select good grafts and we give somatostatin. And of course, there is a lot of, I don't say just give the drug, it's a lot of surgical technique and surgical knowledge. But look that you can go down to 0.5, 0.6. I remind you that the optimal is 1, which is 1,000 grams for a man of 100 kilograms. We go back to Fundeni, and you can see that in Fundeni, every type of technique has been used. Of course, the most is whole transplantation, but split, live donor, reduce, domino, everything is done. And here the important work of doing 126 transplants from live donors. And of course, Vlad is here. Vlad was there in the beginning. I remember him always silent, looking around. So nowadays, the transplantation in Romania, we are now in 21. We see that, yes, it is not stellar. The conditions are not good, particularly during and after COVID. But again, Romania is on the map. These are results in the last years, 2016-17 pre-COVID, and you can see that there is 5 to 3.8. The last one, this is very recent, 2.8 after COVID. And in Romania, again, is not a dictatorial single program. You can see that Irinel and his team spread to other hospitals in the country. And here, documentation that other hospitals do contribute to the load of national burden of patients. What happens? It's finished. I don't know why. It doesn't go on. Can you check who is the technical man here? Ah, yes. So again, in the world, here is Romania. You see not the worst results. The long-term results actually are very good. This is Fundeni, and this is an article for the whole Romanian program, published, of course, in nothing else than chirurgie. Liver transplantation activities also comparable to other countries in the world. And here I come back to the initial point. This is mortality for cirrhosis. You can see that in Romania, we are in the midfield. Now, I speak now briefly of the virus of surgery. The virus of surgery is a bad disease. Many of you probably in this room are affected by this disease. Is the disease of surgery, is the addiction that we surgeons have to the operating room, is we want to operate, we want to do. And it is also a very contagious disease because we give it to our students, and some of them take it very, very seriously and very badly. And the etiology of this disease sometimes is egomania. We have to be careful. The surgeon does it for himself and not for the patient. There is an addictive catecholamine drive when you go and do. It's like when you smoke a cigarette if you are a smoker. You have the Samaritan reflex. It's nice to have people who come back and say thank you to you. And then, of course, those people have it in the brain and they want to do it and they are interested in things and different. But I remind that the surgery is for patients. It's not for us. It's not for institutions. And I think that Irinel knows this very well, how to learn and how to teach. If people would know how hard I work to gain my mastery, my work would not seem so wonderful at all. This is Michelangelo. I don't want to compare us to Michelangelo, who is a genius artist. But what is true is this job requires hours and hours of work. And here we are, of course, hard work and relaxing moments that you need to have. And again, the artist, these are my mountains in Cortina d'Ampezzo. The artist school is here is Verrocchio, was master of the bottega in Florence, and this is the baptism of Christ. This part is done by Leonardo, and this part is done by Botticelli. And so the scholars are learning for the master. The same you can say for surgery. And here I want to signify that it's important for us to pass the baton, to give it to the next generation. Teach means be generous with peers and with your young generation. And this is what Irinel has done. And here we are teaching, and this is our mission now, not to do surgery, to pass it over to the next. So be aware, respectful of the past, conscious of the present, and predicting the future. We cannot say that Irinel did not do this and did not see this. And here, very briefly, a constant invariable element shall remark modern surgery: sense of humanity and preeminent aspect, respect for human beings. Surgery, medicine, and science are miserable things without it, despite all prodigious efforts. And so we do things for patients, and I hope that it will be rewarding to see soon in the next room. The conclusion of this important paper is basically the same. The surgeon must continue to play a honest role, keeping in mind his primary personal responsibility towards the patients. So he started a school, passing the baton. I remember Vlad in the beginning. Vlad today runs the show, and I'm very, very happy to see him after a long time. But Vlad is only one of them. There are many here in the room. And so I wish to pay my tribute to Romanian surgery and to the surgeons from Romania, and of course to congratulate Irinel. Irinel, who in his article says was the barber, the rock star, and now normal. I think he still is a rock star. He has been always in the press and important communicator for the class of surgery, and indeed in the end for the patients. But I like to show Irinel, this Irinel, the Irinel that is truly taking life light, has a lot of energy below the skin, but on surface he looks always very relaxed, pleasant, and a great communicator. So thank you, Irinel. I wish to say thank you to you and for having me here, and thank you to all Romanian surgery, and I applaud myself.
Thank you very much, Professor Malago. And now, the speech of Professor Timothy Paulik. Timothy Paulik is chair of Department of Surgery and the Urban Meyer and Shelley Meyer Chair for Cancer Research at the Ohio State University. Video presentation.
I want to congratulate you on all of your achievements and your successes. You have contributed so much, not only to Romania, but also throughout the world. Your contributions to HPV surgery and transplantation have been universally recognized. I am so grateful to call you a friend and to have learned from you so much. I want to congratulate you and wish you a very happy 70th birthday. We hope that your legacy will live on in all of those who you have trained, and I am sure that those who follow you will build on the great foundation that you have laid for them, and that your institution in Romania will continue to do wonderful things and be world leaders in HPV surgery. Thank you so much, Professor Popescu. I wish you the very best on your birthday.
Thank you. And now Professor Ender Dulundu, Professor of Surgery of Cerrah Pasha Faculty of Medicine, Istanbul, Turkey. Video. Please.
It's very hard to say something about this very impressive and huge experience and background. And it is a great honor and pleasure for me to be here for this special moment. As all of we are know, Professor Popescu, he is a invaluable cornerstone for International Surgical Society, ISGO, and of course, Romanian Surgical Society. With his high scientific performance and very valuable personality, he has always been a good example to his colleagues and young surgeons. He has devoting his life to HPB surgery and liver transplantation and has achieved many success both in his own country and internationally. At the same time, if there is a ISGO and it has reached the point where it is today, he has a great effort and contribution in this regard. I am sure that he will always guide us as a shining light with his unending energy and vast experience that I will not break away from this community. We will be working all together to bring the association and community further and keep collaboration. I wish him a good health and happiness in his future life, and I would like to thank to him again for inviting me to this beautiful country and with the nice people. Thank you very much. Excuse me, can I give as a Iasko some?
Current president of Yargo, and I said so many things about what the radio on the table and really.
And now I invite Mr. Nicola Vladov, Professor of Surgery at Military Medical Academy, Sofia, Bulgaria.
Dear Professor Popescu, I wish you only health and forces to continue your impressive way in the life, and I wish you only health. Thank you very much for all.
This is Byzantine style.
Thank you. For Bulgaria, Professor Lyubomir Spasov, Professor of Surgery. Please.
Dear Chairman, ladies and gentlemen, I'm very proud that I'm here, and I must say only a few words, short story, how we start our transplantation liver program in Bulgaria. Many years ago, 2004, me and my team, we passed training in Germany with Professor Brosch and Professor Mawago. And when you go back in Bulgaria, we try to start liver transplantation program. But fortunately, we are Balkan countries and many things missing in the operation for the people and for the team. We start few times and we try to start, but nothing happened. Finally, I received invitation from Professor Popescu to come here in Bucharest, and we participate in living-related liver transplantation. Here, we was in the operating theater with Professor Popescu. And when you go back in Bulgaria, we start our liver transplant program in Bulgaria only 1 month after this visit here in Romania. Professor Popescu gave us strength, faith, confidence, courage to perform the first liver transplantation in Bulgaria. So I and my team is very, very proud that we are friends of Professor Popescu. And I must say, Professor Popescu is the spiritual father of Bulgarian transplant program, liver transplant program in Bulgaria, because he gives us confidence. So Professor Popescu, dear Irinel, thank you very much for this immense help for us. We are really the spiritual father of liver transplant program in Bulgaria. Thank you very much.
Well, thank you. Thank you, Professor Spasos. Thank you, Lubomir. So just to say a few words, as I mentioned yesterday in private discussions, for me, the neighboring countries were always a priority, and I was always close, first of all, to Bulgarian surgeons, to Serbian surgeons, to Hungarian surgeons, not to speak about the Republic of Moldova. Therefore, it's very honoring for me to hear such a nice words. Besides, thank you very much for the very nice gift.
Okay. The following is Mr. Zoran Milosevic, old friend of Romanian surgeons and Irinel Popescu too, professor of Faculty of Medicine of Novi Sad, Serbia. Please, Professor.
Thank you very much. It's very difficult to say something after all these emotional speeches, especially after the Max presentation. So I'm very emotional too, because I have a lot of memories of our long time friendship. And I remember the first time when I come in Bucharest to meet Professor Popescu, it was 2002 and 3. And during our way to Romania by car, we were rolling the stones on the way. It was after the rainstorm, you know. So I'm still now sorry because I don't have the picture at that time, because it was actually the beginning of our cooperation and establishing the liver transplant program in Serbia, generally speaking, especially in Novi Sad. During our cooperation, I sent in one moment, it was 2007 or 8, I sent my part of the team to Fundeni Hospital, and it was very exciting experience for all of us. Me as the chief of the transplant, in that time I stay in my hospital, and one moment I came to visit my team and with the professor by train. I spent almost 20 hours by train from Belgrade to Bucharest, and immediately tomorrow after one transplant, because I remember Max Malago come in late in the night, we have some problem in the arterial flow, so he put the catheter and prostaglandin inside. So I back by train again. So I spent maybe over 40 hours by train just to see professor, and my team was there. So it's very nice memories. But I just want to say the help we get from Professor Popescu is very, very important for neighboring countries like Serbia, Bulgaria, and so on, especially for the young surgeons. And through Professor Popescu, and of course through the IASGO, the people, young surgeons from this region had a very good position and chance actually to go on international level of sciencing and show results. Of course, we just follow our proposals by very experienced and well-known surgeons in the world. And I just can promise Professor Popescu, we will continue with our works and take care about very, very nice memories for him and our Romanian friends. Irinel, all the best in your future life. And I just want to know that you always can calculate with me and my team. Thank you very much again.
And now, the other old Serbian friend of Romanian surgeons and Irinel Popescu, of course, Professor Alexander Karamarkovic, Professor of Surgery, University of Belgrade. Video presentation.
I have to say that you are one of the best HPV surgeons I know, but more than that, you are the great people and very good human being. So we are really privileged to have you as a dear friend. So let me wish you, together me and Claudia, the best wishes and very happy anniversary birthday. And many greetings and kisses from Belgrade to Liliana and you.
Dear Irinel, happy birthday for many more years of beautiful travels and friendships. Greetings and kisses for you and Liliana.
Cheers, our friends.
Cheers.
All the best.
And now our colleague, Cătălin Popescu, Associate Professor, Department and Surgical Training Institute, Associate Professor of Surgery, Director of Surgical Department and Surgical Training Institute, Private Ponderas Queen Mary Hospital.
Distinguished audience, I'm honored to be here. Dear Professor Irinel Popescu, happy birthday. It is a special day for you, but it's a special day for us. We are here because part of our life, career has been impacted by your personality, your influence and friendship. And we thank you very much for this. It is a special day recalling memories buried in time by the speed of the time, and especially when surgery nowadays with its dynamic, its technology placed them back in our memories. And it's great for us to remember. I recall the time of opening up my eyes in surgery in the 90s when minimally invasive surgery was considered a fashion, probably at max, offering some minimal aesthetic benefit to the patients. And it will be changed with something else. This was probably in the majority of surgeons' vision, but not in the mind of visionary surgeons, as Irinel Popescu was. I remember at the beginning of minimally invasive surgery in Romania. I know that in many of the centers in Romania, it's a revolutionary journey was seen at that time, and I am seeing now here in the room pioneers of that times. And the surgical department headed by Professor Irinel Popescu was one of those centers.
I got the privilege and I was lucky to be part in another team, led by Professor Corneliu Dragomirescu, has been mentioned here. And I recall the meetings at the beginning of minimal invasive surgery when we were so happy that there were some small achievements, now probably not important with the expertise and the technology that we have. The long meetings we had to establish the program to develop laparoscopic surgery in Romania, the competency program. Thank you for this, together with Professor Dragomirescu. The first discussions about creating a CD-ROM. Who is remembering now what is a CD-ROM with techniques of minimal invasive surgery, basic and advanced, and that achievement has been awarded by the Academy, Romanian Academy, very proud of this project under both giants' leadership. At the beginning of Romanian Association of Endoscopic Surgery, who is now the main forum of minimal invasive surgery in Romania. Just to mention some of the special days, some of the special moments that I witnessed, not saying in line, the opening of Pondras Hospital and Surgical Training Institute that were mentioned here. Beside these special moments and the durability of the projects that were launched and existing, and we thank for this. I always admired the courage of thinking different, great, and the disponibility and energy to put in practice the projects, the energy that has been sent to the team, and the willingness to transfer to the team the knowledge to continue what it's to be continued by those who are following you. And thank you for this. Among the projects that were discussed here, some of them were mentioned here, successfully signed by Professor Irinel Popescu. There is one that I will stay on underlying, it's robotic surgery. Because the consistency of the beginning of robotic surgery in Romania is due to the effort of and leadership of Professor Irinel Popescu and all the surgical specialties without exception got a huge benefit because of this. And probably you all remember the difficulties on the way with this program and how it ended up in 2013, you mentioned. The vision was not limited to Romania. The Southeastern Society of Robotic Surgery has been organized under your leadership, and the Congress in 2015, November, was a great event of robotic surgery. But let me continue now. Robotic surgery is performing in Romania more than 1,000 patients a year. I got the privilege to work in Pondras Hospital where the program has been introduced, and we are performing the largest number of robotic surgeries here in Romania. We have a robotic surgery, a Romanian robotic surgery club, and Professor Irinel Popescu is the honorary president. And we are organizing now every year events with international attendance, and it's very important for the development of robotic surgery further on in Romania. And today, in this special day, I got the honor to be the messenger of three important societies. That is the Association of Romanian Endoscopic Surgery, the Association of Biliopancreatic Surgery and Liver Transplantation, and of course, the Romanian Society of Surgery, And I got the privilege to give you, Professor Irinel Popescu, the plug, recognizing your contribution in developing robotic surgery in Romania. We are grateful and we thank you very much for the beginning and what happened after, and wishing you at the same time all the best for you personally, and happy birthday.
Thank you very much, Catalin, for your kindly speech about the personality of Professor Irinel Popescu. And now I invite Mr. Adrian Hotineanu, Professor of Surgery, Nicolae Testemițanu University, Chișinău, Republic of Moldova.
Dear Professor, it's a great honor to be here, and to speak about Professor Irinel Popescu. And I want to speak a few words about what he did for us. For us, I mean for Republic of Moldova, for surgery in Republic of Moldova. I want to mention that he is a mentor of big team in Republic of Moldova. He is my mentor, and he trained more than 30 surgeons from Republic of Moldova from my team. And Irinel Popescu started living liver transplantation in Republic of Moldova in 2013, and it's a history, and it's 10 years of liver transplantation and more than almost 100 patients we did a liver transplantation, and we started with living liver transplantation in 2013. And then with Irinel Popescu in 2014, we started liver transplantation with deceased donors. And I want to mention that his honorary professor of University of Chișinău. He is honorary member of Academy of Moldova, and he was distinguished the greatest Order of Moldova. It's a Order of Republic, Order of Republicii. And now I want to ask him to be with us, and the University of Moldova and Director of Moldova ask you to continue our collaboration. And it's a great honor from University of Moldova, it's a visiting professor, and ask you to be with us and to train surgeons and to train students. And happy birthday, Mr. Professor.
No, just a few words. First of all, a big thank you. Moldova was always close to my heart. I started visiting the university in Chișinău in the early 2000s, and I was many times in Chișinău. But what Adrian didn't mention, sorry.
And this is, our Poșta Moldovei. This is special stamp of the, a lot of people know Irinel Popescu in Moldova because of liver transplantation, because of first liver transplantation in Moldova, and it's great honor to have, you are a citizen of Moldova. You are a citizen of great Romania, and we are honored to be with you.
Okay, thank you. This is very honoring. Thank you very much. Thank you very much. But still, the greatest gift that I received in Moldova is a bottle of wines in Cricova.
Thank you very much. And now I invite Mr. Dan Duda, Associate Professor of Radiation Oncology, Massachusetts General Hospital, Boston.
Thank you very much, Mr. Chairman, Professor Popescu, distinguished audience, dear friends. It's really humbling to speak today after you heard the amazing accomplishment in surgery described by Professor Malago. I'm not a surgeon, so I will not provide any kind of input on that area, but I have the privilege of speaking about you with Professor Nikolidakis, with Professor Makuchi, with Professor Nakao, with Professor Brosh, and so on. So I know how they considered you being, as you said, a star. So that's probably the highest praise you can get through indirectly from me, from these people. What I would like to emphasize today is your contribution to translational medicine, because I don't think a lot of surgeons think about it or have the time to devote like you did. And you mentioned in 2002, you started this effort long before, even internationally, this was an effort, very much along the same time we did it. And when we met in 2007, your openness to this idea was really outstanding. So it's been really a privilege and an honor to collaborate with you as a wonderful collaborator, friend, mentor for the last 16 years. So that's truly another contribution to Romanian medicine that I would like to emphasize today. And then we talked about the difficulties that you faced. I've been living in the United States for more than 2 decades now. You know, the highest accomplishment, the highest praise is for those people who succeed against all odds, against all the adversity and all the problems. So you know, and since we talked about astronomy a little bit with Professor Malago, you know, when Kennedy was trying to sell to the American people the trip to the moon, he was talking about this, that, you know, we don't do these things because they're easy. We do these things because they're hard. And they actually leverage our energies and skills to reach the goals, and you have reached the moon. So congratulations to you. This is a landmark for you, of course, in your life, in your career, but I really believe you have a lot more to offer to Romanian medicine. I wish you a long and productive life. Thank you very much.
And now I invite Mr. Boris Rubinsky, Professor Boris Rubinsky, Berkeley University, United States.
Thank you for having me here. Professor Irinel Popescu, I wish you a happy birthday și la mulți ani. From my experience, I retired 15 years ago. And during these last 15 years, I've done much more and better science than ever before. So I wish you absolutely the same. And I was inspired by Professor Oppenheimer, who was in our department and at Berkeley, and he used to come every day with his Porsche to the laboratory and worked till 95. So I wish you till 120. I had many good experiences in my career. I had the opportunity to spend a year with Sir Ray Khan at the Edinburgh Hospital, and with a year with Collins of the Collins Solution. So I'm proud to add your name to the distinguished people with which I have collaborated in my career. It was an absolute pleasure the last 7 years. I think we made some substantial breakthroughs. Our work on electrolytic electroporation, they mentioned here robotics. Well, very soon, of which your paper is the first that did a large animal study. Very soon, the robotic system will have your device. The isocoric technology that we develop, I believe that in 5 years, it will be the technology for liver preservation as a norm. So I wish you a great future, and I'm looking forward to collaborations from now on. Thank you very much.
I invite Professor Attila Olach, old Hungarian friend of Romanian Society of Surgery and Professor Irinel Popescu, of course, Professor of Surgery of University of Győr, Hungary. Video conference, video presentation.
Dear Irinel, first of all, happy birthday to you. Your name of Professor Popescu from Romania, is a very well-known brand all over the world. In each surgical society, in Europe, in US, in Japan, in Australia, in Brazil. And I'm always very proud to say that, oh, Irinel is a very good friend of mine. You have to know, from today, you have become a surgical living legend. God bless you.
Irinel, happy birthday.
And the last but not least, Professor Cătălin Fetecă, the president of Dunărea de Jos University Galați. Senat, no? Please.
Distins auditoriu, stimate domnule profesor, îmi cer scuze, mă voi adresa în română pentru a nu scăpa anumite nuanțe. În primul rând, este o foarte mare onoare pentru mine, pentru comunitatea academică a universității pe care o reprezint, a comunității gălățene și a credincioșilor ortodoxi din zona noastră, întrucât mesajul de într-un mulți ani îl transmit și din partea arhiepiscopului nostru, în al preasfinția sa Casian, și, bineînțeles, din partea Senatului Universității Dunărea de Jos din Galați și a mea personal, transmit un la mulți ani unui înger aducător de pace, întrucât Irinel în limba latină înseamnă înger, iar în greacă înseamnă pace. Într-un mulți ani fericiți, mulțumim!
Professor Irinel Popescu, you are a great personality of Romanian surgery and medicine. Happy birthday and good health.
Okay. O secundă, vă rog, o secundă. Vreau să fac un scurt anunț, deci cu aceasta ceremonia este închisă. Aș vrea să-i mulțumesc colegului și prietenului Silviu Constantinoiu pentru efortul pe care l-a făcut. De acum, cei care doresc să se mute alături unde este ziua transplantului și să sărbătorească împreună cu noi ziua transplantului, acolo vor fi alte luări de cuvânt mai mult din România, fără discuție. That's why I'm speaking in Romanian. So next door, we will speak in Romanian. It's a day of transplantation. Dar colegii care doresc să înregistreze mesaje o pot face, este o cameră de luat vederi care asta face și toate împreună cu cele pe care le-ați văzut de la Otilo Olah, de la Alexander Karamarkov, vor fi într-un testimonial video, așa încât personal aș fi onorat dacă cei dintre dumneavoastră care doresc să spună câteva cuvinte o vor face în fața camerei de luat vederi, ca să avem scurte clipuri video cu această ocazie. Și vă mulțumesc tuturor pentru participare.